Welcome to Global View. Join us on this multi-visual journey around the world.
Today we reached a historic milestone in our war against the coronavirus. Over 1 million Americans have now been tested, more than any other country by far, not even close, and tested accurately. In the days ahead, we're going to go even faster, and we have something from Abbott Labs, which is right here, and that's a 5-minute test, highly accurate. And I maybe can show that as we listen to our FDA commissioner, the job he's done and the approval process.
I'm very proud of FDA's staff's work in the last few months to expedite the availability of testing in this country. I'm also incredibly appreciative of private industry's ingenuity and willingness to work with us quickly to develop and distribute those tests. We've had a substantial addition to testing with the authorization of point-of-care tests, especially the Abbott point-of-care test, which the President has pulled out of the box. A point-of-care test is a test that gives you a result where you're getting care. This is truly a patient-centered approach, whether it's the doctor's office, a hospital, an emergency room, an urgent care center, or a drive-by testing site. Just like tests for flu or strep, where you go to the doctor so you get the test done, you can get an answer within minutes of having this test done. Now, with those tests being approved for Abbott and for others, these are available around the country. They're planning to scale up the number of tests that can be put out throughout the country over the next month, and patients can get the answer within as little as 15 to 5 minutes. And then, of course, an appropriate plan of treatment can be given.
The pharmaceutical company, Sandoz, has been working with us very closely. And as Alex mentioned a little bit, 30 million doses of the hydroxychloroquine to the United States government has been given. And Bayer has donated 1 million doses of the chloroquine, which will soon be distributed to states and state health officials around the country. Teva Pharmaceuticals is also donating 6 million doses of hydroxychloroquine to U.S. hospitals, 6 million doses. So the private sector, as you'd say, Steve, it's been amazing what's happened, really amazing.
The USS Theodore Roosevelt's commanding officer has been relieved of duty by the Navy after raising alarm bells about a growing number of sailors sick with COVID-19 on his aircraft carrier. Our national security correspondent, Jennifer Griffin, is live from the Pentagon with more on this story. Good morning, Jennifer.
Good morning, Ed. Hours after the acting Navy Secretary fired Captain Brett Crozier, hundreds of crew members gathered on the USS Roosevelt's hangar bay to give him a roaring send-off chanting his name. 114 sailors have now tested positive for COVID-19 on board the aircraft carrier. It appears the crew is ignoring guidelines to social distance to send a message of protest to top Navy brass for firing their skipper, who sounded alarm bells about the rising number of coronavirus cases on his ship, forced to arrive in Guam a week early.
I did not come to this decision lightly. I have no doubt in my mind that Captain Crozier did what he thought was in the best interest of the safety and well-being of his crew. Unfortunately, it did the opposite. It unnecessarily raised alarms with the families of our sailors and Marines with no plan to address those concerns.
On Sunday, Captain Crozier wrote a letter that leaked to his hometown newspaper, the San Francisco Chronicle. In the letter, Crozier is urging senior Navy leaders to offload most of the 5,000 sailors on board immediately to disinfect the ship, adding the spread of the disease is ongoing and accelerating. Quote, "We are not at war. Sailors do not need to die. If we do not act now, we are failing to properly take care of our most trusted asset, our sailors." The acting Navy Secretary said the Roosevelt captain had acted emotionally without discussing the letter with his immediate strike group commander, who is just down the hall on board the ship. Instead, the letter was sent over an unsecure, unclassified email system.
Does this not have a chilling effect on other Navy captains?
What he did by doing this and not being careful with who that information went to, but it was copied to 20 or 30 other people, okay? That's just not acceptable.
Help has arrived. The 900-foot USNS Mercy ship sailed into the port of Los Angeles Friday morning. The former oil tanker has been converted and armed with 1,000 beds, doctors and nurses, and a mission: relieve Los Angeles hospitals, many of which may soon be overwhelmed.
It is days like this that makes us so proud. In any way we can help our communities, we're stepping up. You look at this promenade here, and so many of our neighbors and friends, our colleagues at work are out here lending a hand.
Every patient to be treated here will be thoroughly screened for COVID-19 before being admitted. The Mercy will only accept patients who test negative, leaving the hospitals in the city to focus on patients suffering from the virus. Here in Los Angeles, around 90% of beds are already in use in hospitals, and with the number of cases increasing rapidly, this ship will free up major resources such as ventilators and intensive care beds. There are 11 operating suites on board, along with the blood bank capacity of 5,000 units, 15 wards and 80 intensive care beds. And there is a CT scanner and radiology suites so that patients will have access to screenings when needed. California Governor Gavin Newsom appealed to US President Donald Trump to deploy the Mercy from San Diego to LA, and the governor was at the port to greet the ship.
We now are seeing a spike that we were anticipating, that we were modeling, but that we were substantively preparing for. And part of that preparation is exampled with the ship you see behind me.
The arrival of the Mercy will provide some small comfort to the city of Los Angeles, where experts say the number of cases could reach 1 million in a matter of weeks unless stringent restrictions remain in place. Duncan McKenzie-McCarg, TRT World, at the Port of Los Angeles.
Help, but instead is part of a federal government plot to control our lives. The train derailed under the span of the Vincent Thomas Bridge and ended up just a couple of hundred yards away from the U.S. Navy ship Mercy that was docked in the port of L.A. Tonight, KCAL 9's Stacey Butler has the latest on the suspect's apparent motive.
Say 44-year-old Eduardo Moreno, the train engineer, purposely ran it off the tracks. They say his intention was to crash it into the USNS Mercy. Just before 12:30 Tuesday afternoon, a CHP officer says he saw Moreno purposefully run the train off the tracks through concrete and steel barriers, through a chain-link fence and 3 unoccupied cars before it finally came to a stop. Luckily, no one was hurt. That CHP officer and Port Police took Moreno into custody. He apparently told the CHP officer he believed the USNS Mercy was tied to a government plot. He said the whole world is watching. I had to. People don't know what's going on here. Now they will. He was taken into custody, where he told FBI agents he did it out of a desire to wake people up. Moreno stated that he thought the USNS Mercy was suspicious and did not believe the ship is what they say it's for. Mayor Eric Garcetti said, luckily, the crash did not impact non-COVID patients on board receiving care.
In terms of the derailment, no, that shouldn't in any way change the operations. We still have vehicle access. We can get folks in and out of there, and they have been accepting patients.
Moreno says he acted alone and didn't plot this out ahead of time. He now faces up to 20 years in prison.
Developments tonight in that bizarre case of the man accused of trying to ram a speeding train into the hospital ship Mercy. CBS 2's Amy Johnson spoke with a friend of the suspect,
who says he is absolutely shocked by what happened.
It just doesn't make sense. It's just none of it. None of it makes sense at all.
With tears in his eyes, TJ Schlick told us about his friend, 44-year-old Eduardo Moreno, or Eddie as he calls him.
He's a father, loving husband, good friend, guy that gives you shirt off his back. You know, I mean, he's always been there for me.
Moreno, a train engineer, is accused of derailing his train Tuesday afternoon in an attempt to hit the USNS Mercy hospital ship.
To tell me he's going to do something like this, it's going to take him away from his family, just not right. Something wrong.
The two have known each other since they were teens, working as deckhands on fishing boats. Both became captains.
There's no way that train was ever going to reach that ship. I mean, so to sit here and tell me that he's going to take that train, even at full speed, and take out a Navy ship that's just unreachable, with knowing how smart Eddie is, this is not in his realm. I mean, to tell me he's going to do something to hurt a vessel, I mean, Eddie's love for the ocean and boats, yeah, I'm not buying that.
According to the FBI, Moreno said he wanted to wake people up. He thought the ship was suspicious and not there for what authorities claimed.
There's never been a talk of any type of conspiracy. There's never been any attitude like anyone's out to get us.
Friends have organized a GoFundMe account for Moreno's family.
Eddie is loved by everybody, you know. I mean, You can't replace the guy.
Well, our next guest is here to give us more information on the USNS Comfort that just arrived in New York City. Navy medical professionals on the ships in New York and California will assist local healthcare providers by offering care to people who do not have the virus, freeing local hospitals and clinics to treat COVID-19 patients. So joining us now via FaceTime is Captain Patrick Emersbach, USNS Commanding Officer. Captain, thanks so much for being with us. I want to know if you felt all the love, relief, and joy that everyone is sending to you and your crew. When we saw that ship come into the harbor, into the Hudson, it was almost like you could hear the cheers. Did you feel that?
Oh man, absolutely. The entire crew did. I've never been more proud of what we're doing for our nation and the people of New York City. Absolutely felt it deep down to my bones.
I hope you continue to feel the love because we are sending it your way. I want to know, is the ship ready today for access?
Yes, ma'am, it is. Our goal was pulling in yesterday and within 24 hours being available to receive our first patients, and we are on track to do that.
All right, and how many patients can your ship hold?
Ma'am, the ship was designed for major combat operations, so it has a maximum capacity of 1,000 beds. We have 80 ICU beds, 20 post-anesthesia care beds, with the balance being medical surgical type beds. Again, it was designed for major combat operations. So many of those would be bunk beds. So we'll work hard with FEMA and local authorities to make sure that those that are transferred to our ship are appropriate, knowing our limitations.
Yeah, and talk a little bit about the types of procedures or treatments that can be done on board your ship.
Sure. So again, we are a full spectrum hospital, if you will. We have radiology, 4 suites. We have a CT scanner, a full lab capability, pharmacy, ICU with better ventilator capability, anything that you would find in a regular hospital. In addition, we have the ability to produce and feed our over 1,000 crew, over 3,000 meals per day.
Over 1,000 on your crew. I'm curious, are they all members of the military, or are they from some local hospitals? Give us a sense of who is among your staff.
Sure. So we have 75 professional civilian mariners on board who are responsible for the operation of the ship, the navigation, and the power. And we have over 1,000 medical professionals, for the most part, come from military treatment facilities, Navy, on the East Coast of the United States. Our largest contributor is Naval Medical Center, Portsmouth. We also have 120 reservists on board, also from Maine to Florida, on board to provide support to New York City.
Well, we certainly feel it. You are a beacon of hope for all of us who can look out our windows and see your ship there in our harbor. Thank you so much, and thank you to your crew as well, Captain Emersbach, for giving us more information on the Comfort ship. We certainly wish good health to you, and please know and feel our gratitude.
Thank you, ma'am. We appreciate it.